Let me turn to Gavin Macgregor Skinner. He's a director of the Global Biorisk Advisory Council. Gavin, how much our world has changed since you and I had a conversation last time. You send us a number of photos. We're going to put them up on the screen, and I just want to get your take what we're seeing in these photos. One of them, I believe, you have a full protective gear on and your head is covered. The other one, you appear to be with another person inside a tent. Explain these pictures to us.
Yes, so a lot of the hospitals that I work in now have created zones. You'll see, if you're a patient or a person going to a hospital now, you'll see a green zone, a yellow zone, and a red zone. You need to stay in those green zones. If you find yourself accidentally in a yellow or a red zone, you need to just stand still and wait for someone who works in the hospital to help you to get out of those. That's a level of risk assessment we're putting into hospitals. But I want to emphasize that for any frontline worker, hospital, firemen, police, even cleaning staff, we are training all the time, and we're taking this from our first principles. How do we stop infection occurring? Stay away from people that may have the infection that are sick, but also protect your eyes, your nose, and your mouth whenever we're working on the front lines in hospitals or we're dealing with the general public on a day-to-day basis.
Gavin, one of the pictures, as I was mentioning, shows you inside a tent. It appears to be a tent hospital. When was this taken? Where is it?
Right. Okay. So up and down the east coast of the US, where I work in 5 states, we have set up tents outside the hospitals in the car park. And what we're trying to do is to protect those areas of the hospital, like labour and delivery, where mums have babies, like where if a child broke their arm, could go get their arm fixed. So we're actually anyone that has respiratory symptoms or thinks they have either a cough, a chest infection, or even a nasal infection, they go to this tent where we can ask them the special questions and we can also do the testing. So we're training staff now to work outside the hospital in these tents before we actually have to take the patients into the hospital. Those that don't have to go into hospital, then go home and they get home care, they get looked after by loved ones in the home, and we give them guidelines and instructions on how to do that.
And in the visits you've made, is it your sense that they have the equipment they need? They have the face mask, they have the gloves, they have the personal protective equipment?
No, there are shortages, but this is all about numbers. So in every hospital I work in, we know exactly how many numbers of respirators, gloves, eye protection, face shields, and also the suits we have. And then we know how to allocate those based on risk. But we're also improvising. So you can see that in one of those photos there, I'm wearing a waterproof jacket and a waterproof set of pants that I just bought from a camping store. Even though I work in a hospital, it allows me to wash them down with soap and water and disinfect it, kill and inactivate that virus. And it allows me to work safely without using the very high, valuable personal protective equipment that the doctors and the nurses need when they're treating a patient that may be on a ventilator.
And Gavin, what is the biggest need and shortage right now?
The biggest need, again, with the hospitals I work at is food. I'm so grateful for so many of the restaurants and other facilities that are supplying us daily food. We don't have time to make our own food. It's food that we heat up in the oven or the microwave. But also this face shields. Face shields play such an important role. I was working with law enforcement, with police officers the other day, and they said, Gavin, we have nothing we can protect our eyes, nose, and face with. They actually had shields in their cars that we could actually put on their faces. We could clean and disinfect those, and it stops those droplets. It stops those people when they're coughing, breathing, talking on them from getting that infection in their eyes, nose, and mouth. So now we've made the police force even safer, and we're doing that for a lot of other first responders as well.